For patients who are now having inflammation, joint pain, certain knee injuries, what are the techniques that are out there now that we can do to help them before they may need to have surgery, or people who may not want to have surgery?
Right. The most basic thing is trying to keep people active, right? So when you exercise, you release endorphins, your mood is better. People that exercise more strenuously usually have less risk of having, these chronic pain syndromes, okay? This also go along with like hormone replacement, women that are perimenopausal, menopausal, or early hysterectomy, those people are at risk. Men that have low testosterone, the low testosterone affects not only their libido and their mental health, but it also makes them more susceptible to chronic pain issues. So I think keeping them moving and keeping them exercising, balance, which becomes so important as you get older, and then you have the fall risk, is doing things like Tai Chi, yoga, incorporating flexibility into their workout plan. If I had to recommend one thing, it would be strength training, right? Because the more muscle mass you have, the less risk you are for a lot of things,
That
right?
is correct, yes.
It does keep down your resting insulin level. You're able to consume more calories and burn them even though you're not working out if you have a higher muscle mass. It also keeps the bone density strong, so when you do fall, that you're not actually going to break a bone at that point.
In my experience too, we've had a lot of patients with falls simply because they didn't have the muscle strength to lift their foot over a rug.
Right.
Or a tree branch when they're walking outside. These are the injuries we're hoping to prevent. And so I know you have experience in doing like regenerative treatments for patients, can you expand a little bit on that?
This is where it kind of differs from the insurance-based model, because there's things that our insurance will pay for, as I'm sure you're aware of in primary care, right? So insurance wants to pay for physical therapy, which I love physical therapy. It is one of the best things that someone that's aging can do for their balance and their strength. But steroid injections, they're harmful. As a primary care doctor, you know the bad side effects that people can have from these long-term use. They're toxic to our joints, they're toxic to our tendons. Usually when you go to an orthopedist and you have joint pain or swelling, what are you gonna get? Maybe a Medrol dose pack at the primary care, and then probably some type of steroid injection mixed with some lidocaine, which is also toxic for your joints. So even if you have arthritis, now you're accelerating the arthritis based on what the insurance model will pay for.
Right.
So that's where you get into, more organic regenerative techniques like platelet-rich plasma, A2M, which is a protein concentrate, which we make off of the PRP, which actually keeps the proteoglycans from breaking down the cartilage in the joint. Stem cell therapies such as bone marrow, and we can also harvest from the fat. And so these are things that are organic, they're from you. I'm not putting anything into you that's not you. So I always try to tell people, be as natural as you can and not incite any more harm to the body. Better to heal naturally than to, do something that'll make you feel good today, but it's going to be bad for you in the long term.